Okay, let's go ahead and open up the Zoom room. Hello, everyone, and welcome to Daily with Doc. My name is Becca Dukes, and as the hostess of this program, it is my honor and privilege to be able to share with you solutions to some issues that go around the world, not just what was going on with me. So, as a product of the Critical Health News newsletter and show, we have created Daily with Doc as a way to continue to share the message that brings hope to so many when hope is not given except in a pharmaceutical. Well, folks, we were not made from pharmaceuticals. Our bodies were made and divinely created to be able to continually generate and regenerate cells throughout the whole entire body. So when that happens, and it takes raw ingredients in order to make it happen correctly, efficiently, then we got to make sure that we're giving it all the raw ingredients in order to allow it to do it at its optimal best. And that's one thing that we share here on the Daily with Doc show. Now, this program is a resource to an amazing community, and we just welcome everybody. And as we welcome everybody, we want to make sure that if somebody invited you to this program, make sure that you get back with them. Tell them thank you for sharing the program with you, and let them know what you liked best about it. Also, if you would like to become involved and get started on a program that meets your individual needs, make sure that you ask them, what can I take? What would Dr. Wallach recommend for me? So the person that shared this program may be one of those amazing certified holistic health coaches who have been trained in Dr. Wallach's teaching philosophy that uses his research to not only connect the dots between poor health conditions, but also how they relate to nutritional deficiencies. So again, get back with the person that shared this program with you. If there is no one to thank, we do have a call team at 855-949-3377 available to assist you in helping you find what it is that you as an individual need within your intentional supplementation, because it's not in food, to meet your optimal best. Now, this program is meant for educational purposes only. It is not meant to take the place of your primary care physician, nor are the products intended to treat, diagnose, or cure any disease. But folks, when you meet with one of the founding fathers of the science of epigenetics that has proven the genetic theory of disease transmission to be incorrect, then it's time to open up your ears, listen, hear, not just listen, but hear what we as individuals can do to help ourselves not become dependent on chemicals. So without further ado, I just want to say hello and welcome to everybody. If you are here live with us, make sure that you have that chat open, because we have some amazing co-hosts who provide information within that chat so that as you are listening, you can also read. So we've got the visual learners, we've got the audible learners. We're trying to help everyone, folks, be able to learn where you learn best. If you're out on one of the platforms watching a restream or also one of our live streams, make sure that you communicate with us that you're there. So if there's a way to chat, chat. If there's a way to give us a thumbs up, give us a thumbs up. If there's a way to give us a heart, show us some love. And most of all, share, share, share. And as a thank you to you from me and the whole Daily with Doc team, if you go to dwdgiveaway.com, sign up for our giveaway, as I will be sending out free products to those who share the most. So with that being said, it is my honor and privilege to bring to the screen with me the one, the only, Dr. Joel Wallach, one of the founding fathers of the science of epigenetics, as I mentioned, who has been instrumental in so much in his short life, including finding the first non-human case of cystic fibrosis, which was said to be a genetic human disease. Also finding one of the mass die-offs of pollution in lambs and how nitrates affect the body. And also finding what we can do to help those with conditions of muscle wasting, neurological wasting, demyelination. Folks, there's so many different conditions, poor health conditions and symptoms that Dr. Wallach has linked to nutritional deficiencies, and we are here to help you figure it out, with today being about the lungs and conditions of the lungs. So Dr. Wallach, hello.
Hello, excuse me, hello, Becca, and hello, team. It's always an honor and an elevation of energy to be working with you ladies and gentlemen. So I can't thank you enough for doing this. Even when I'm doing other things, you're making it happen. And of course, working with the team.
The team, yes. Well, and the whole community, Dr. Wallach, because we are just a small portion of an amazing community who love and care about people, have been able to find your message, put it to use within our own bodies, and reap the benefits of it. So thank you, Dr. Wallach.
You're welcome.
So let's talk about the lungs.
Okay, very important piece of anatomy. You can live without your fingers, you can live without your legs, you can live without your ears, you can live without your eyes, but you can't live without your lungs. Okay, they get rid of bad stuff, the carbon dioxide that builds up in your body as you're moving around and using oxygen. You produce carbon dioxide as a byproduct of energy expenditure. And also, the lungs bring in oxygen, which is required by every cell in the body to function properly, whether it's your lungs, whether it's your heart, it's your liver, your stomach, your brain, your eyes, your muscles, your bones, skin, the digestive system. Everything requires oxygen. So we're all dependent on the lungs and the respiratory system. Okay. And of course, even in Boy Scouts, you learn how to, when people become unconscious, you learn how to do respiratory stimulation, okay, to get the lungs working again and that kind of stuff. So everybody knows how important the lungs are. In fact, one of the 12 pairs of cranial nerves is devoted almost entirely to the lungs, the 10th cranial nerve. Okay. 10th cranial nerve, and we're talking about, okay, the sciatic nerve. Everybody thinks, oh, sciatica is my lower back. Yeah, but
for the vagus. So the 10th is the sciatic.
The 10th cranial nerve, yeah, does 99% of the nerve stuff to the lungs. Okay. Most people don't know that. They always think of it as their low back and that kind of stuff, sciatica. Okay. You don't want to have sciatica because that means your 10th cranial nerve is being very busy doing something else, and it could forget your lungs and everything stops. Okay. And so it's very crazy. And so and the respiratory stuff that the sciatic nerve deals with, everything from the diameter of your nostrils, whether you're producing mucus to keep the lining of your nasal passages and your larynx all nice and functioning, is not just the lungs. That cranial nerve number 10 is so important to the respiratory system, your larynx, your trachea, your bronchi. And when you start thinking about all that, the 10th cranial nerve, okay, is so important. Okay. So I just want to make sure that everybody knew that, that the lungs don't just deal with their functions by themselves. Okay. They're being told what to do. Okay. So let's see here. Respiratory symptoms may accompany other symptoms. We're talking about symptoms of disease and pre-disease and that kind of stuff. For instance, if you have osteoporosis of the skull, squeezing the 10th cranial nerve, and you're getting respiratory symptoms, do you have a respiratory disease? No. But the fact that your skull is squeezing the nerve that tells your lungs to breathe, even though you don't have any disease in the lungs, but if your skull is squeezing that 10th cranial nerve, you're in trouble because your lungs stop breathing. Okay, there's nothing wrong with the lungs. It's just the message system says shut off. Okay, and most people don't realize all that. So it's very important that everything works, whether it's your mouth, your throat, your stomach, your intestines, your colon, your skin, your heart, your brain, your spinal cord, your peripheral nerves. I mean, it's like crazy how many things need to be working properly just to be able to breathe oxygen. Okay, so respiratory symptoms accompany other symptoms, as we've just said. Absence of breathing. Okay, you hold your breath, you consciously, proactively hold your breath because maybe there's some kind of stinky chemical out there. Your lungs don't like that, so they start beating faster and faster and faster, trying to compensate for you stopping breathing. Okay, a cough that gets more severe over time. So this is a gradual thing, cough that gets more severe over time. Okay, I always want to think of the osteoporosis of the skull, and there is a CD that goes along with it that covers the spinal cord, including the 10th cranial nerve. Okay.
This way. So I've got, it's all in your head. And here we talk about the 10th cranial nerve in chapter 11. And I love the fact, Dr. Wallach, I love the fact that when you've done this, you actually show the different parts of the body that are affected or controlled or regulated by that nerve. So I love that the graphics that are put in this help you understand better what's going on. So, and this is just one of the books that Dr. Wallach and his wife, Dr. Ma Lan, have written that helps us know what's going on in a way that is easy to understand. And it's called It's All in Your Head. And like Dr. Wallach, it does come with a CD. And you can find that at his website, drjwallach.com. So go ahead, Dr. Wallach.
Okay, so absence of breathing. Well, apnea is the name for that situation, apnea. Okay, you could get knocked in the head. You can get really some severe osteoporosis of the skull, squeezing that 10th cranial nerve, and everything stops. Okay. A cough that gets more severe over time. You're gradually coughing more and more and more and more and worse and worse and worse and worse. Again, this will affect how the diaphragm works, making the lungs work properly. Coughing up blood. Okay. Hemoptysis, this is a term used for coughing up blood. Now, that's very scary. That means something is going on, which is scratching. I mean, you could have inhaled a little piece of bark from a plant or a tree or a bean or something like that and not even know it. Okay. And so that thing's rolling around in there causing bleeding. Okay. Let's see here. How about coughing up clear yellow, light brown or green mucus? You might have an infection in the lungs. Okay, difficulty in breathing. Now, there's many, many things, as we've discussed earlier, can cause difficulty in breathing. And people say, I need some oxygen here. Okay, what they don't understand is you need to find out what's causing the difficulty in breathing. Okay, it could be, again, osteoporosis of the skull, the 10th cranial nerve being squeezed. It could be caused by some of the other cranial nerves being squeezed. And it's one of the reasons why you want to read that book and say, oh my gosh, these 12 pairs of cranial nerves, if any one of them gets squeezed, things happen. Okay, if something happened down in your spinal cord, it can be affecting how you breathe or you don't breathe. Okay, very important to know. Okay, let's see here, loose, wet cough that produces thick white or yellow phlegm. Okay, rapid breathing, tachy, okay, tachypnea, rapid breathing. This could be caused by, again, injury to your spinal cord, an injury to your neck, some of your vertebrae in the neck, putting pressure, okay, on the spinal cord, which gives information up to the brain, okay, and down all the way to your toes. And so this is not complicated, but it is complicated, okay? Rapid breathing, okay, tachypnea. In rapid breathing, you just be scared and breathe rapidly because your body's saying, you got to get out of here, man. Go ahead and breathe rapidly, get more oxygen to the heart, get that blood full of oxygen, get it to your legs and get out of here. Okay. Shortness of breath. This can be caused by many, many things. Again, a stroke, blood clot. This can be caused by osteoporosis of the skull. This can be caused by an infection in the lungs, like pneumonia, wheezing and whistling sounds made while breathing. Again, can be due to things going on that actually fill some of these little little what little balls in your lungs that can get air in and put them into the bloodstream to go to the rest of your body.
The
If those,
alveoli?
I'm sorry. Yeah,
Is
the
that the
alveoli. Yeah, the alveoli. If those alveoli get full of infection and pus, they get full of sand and dust and dirt, you're in trouble because it will affect how the lungs can work and what it does to send messages to the heart and so forth. And okay, respiratory symptoms may accompany symptoms related to cardiovascular system, including absence of a heartbeat. Well, there you go, a heart attack. And sometimes your heart doesn't stop when you have a heart attack. It will beat irregularly. Okay, it will beat irregularly. And see, angina, chest pain, again, this has to do with decreased blood supply to the heart muscle. Causes angina, which causes chest pain, which causes difference in breathing. Chest pain or pressure for many, many reasons, as we've just discussed. Irregular heartbeats, arrhythmia. Again, this can be caused by osteoporosis of the skull, squeezing the cranial nerves. It can be caused by squeezing the spinal cord. The spinal cord is giving misinformation to the heart. Low heart rate, bradycardia. Okay. Again, has to do with cranial nerves being squeezed, low oxygen, rapid heart rate, tachycardia. Could be the same thing. Just depends on what side, where you're at, and where the squeezing is taking place. Okay. Okay. Respiratory
So,
symptoms. Okay, go ahead.
well, I know there's a lot of symptoms. I mean, you've already mentioned a couple handfuls of things that affect the lungs. What, let's go right into how are these nutritional deficiencies? Because you had talked about the squeezing of the spinal cord. You've talked about osteoporosis of the skull. So there's a lot of people that have osteoporosis of other things, but very few of them have probably heard osteoporosis of the skull unless they have heard you speak in the past, Dr. Wallach. And I know that the NIH says the exact causal link between malnutrition and COPD, which is a lung condition, is complicated and likely to be bidirectional, with malnutrition both as a cause and consequence of respiratory disease. So when we look at symptoms, Dr. Wallach, so many times they will link those symptoms to quote unquote a disease.
That is correct.
So if we're looking at the lungs and we're looking at osteoporosis of the skull and pinching of the cranial nerves, in many cases, cranial nerve number 10, as you mentioned,
Vagus nerve.
the vagus nerve, what can we do, Dr. Wallach, nutritionally, or how nutritionally are those things affected? Is probably the better question to start with. How are they affected by nutrition that's causing these things to happen within the body?
Okay, well, osteoporosis, whether it's in the skull or your legs, your vertebrae, your ribs, your arms, osteoporosis is a nutritional deficiency.
Okay.
It's a nutritional deficiency. You need the minerals, you need the vitamins to make everything work. And this is like every minute of every day for the rest of your life. When you're sleeping, your heart is beating, you're breathing. You need that oxygen coming in and out. And many people die in their sleep because they get a blood clot, a stroke, or they may get a pinching of a nerve while they're sleeping and roll over funny or something like that. And it stops the nerves, especially when you have osteoporosis of the skull. The reason why we came up with a book, the reason why Dr. Milan and I came up with a book, It's All in Your Head. Being a pathologist, and she's a clinician, I would see so many people that died of things that were associated with osteoporosis of the skull. And of course, the actual cause of death was they stopped breathing. Okay, because of osteoporosis of the skull squeezing that 10th cranial nerve, shuts off the switch, so to speak. And so it's one of those things where doctors just never paid attention. They never knew about it. And so I figured, okay, it's time after a couple hundred autopsies of these sorts of things, actually thousands, I will write this up and make a book out of it. And it's one of our best-selling books because doctors never get taught this in school. Repeat that, doctors do not get taught this in school. The relationship between the skeleton, the nerves, and your respiration. They just think of, oh, you got pneumonia, we're going to give you some antibiotics. If you're breathing funny, that's what they're going to do is give you some antibiotics because they think you have pneumonia. Okay, well, that may be true, but it may also be true you have pneumonia because you couldn't get any white blood cells or antibodies to your lungs because you also had osteoporosis of the skull squeezing that 10th cranial nerve. Okay, and so disease in animals and humans and plants don't occur as one thing. Okay, you just have only one type of cell afflicted. Okay, when you get diseases, especially when organ systems are involved, there's many avenues are afflicted. Okay, we're talking about blood vessels, we're talking about nerves, we're talking about things that have to do with skin, bones, cartilage, ligaments, tendons, muscles, and so glands, all these things are connected. Okay, how they all approach the same problem. And so this is all, I think we did a very good job. We're going into the second printing now because we sold, I don't know how many thousand of those books already. So we've got another batch coming out here. Of course, we've added a few more new things we learned.
So, Dr. Wallach, as we are going through, you mentioned specific individual symptoms that are going throughout the body, even not related to the lungs, but directly, but they still cause things to happen within the lungs as well. And And one thing that I've noticed when I was reading the daily with or the don't Dead Doctors Don't Lie book. This was prior to you finding the company Longevity. And you would go through and mention different poor health conditions and nutrients that you had found to be missing or deficient within the bodies that had those symptoms through your autopsies and experience with that. And it's amazing how so many people don't connect all the different parts of the body being connected to something else. So if you've got heart disease, we think, oh, it's just something going on with my heart. But that's not true, is it?
Not true. It has to do with your lungs. It has to do with your digestive system, your muscles, your bones, ligaments, tendons, your immune system. All these things are involved. Whether you have a little sniffle up in your nasal passage or you have really serious, really life-threatening pneumonia. And so these are infections. But what about the mechanical things? This is something they weren't paying attention to at all. It was mechanical things. And being an athlete, and I was small. I only weighed 115 pounds. I played football for a junior high school, university, wrestled for those three school levels, education levels. And so I was taken when I was 10 years old. I was taking it only weighed 115 pounds. I was taking more vitamins and minerals, all these big 200-pound athletes and, so forth. And they're the ones that got all kinds of problems. And I never
Mm-hmm.
had those problems because I'm taking all these vitamins and minerals and staying away from the bad stuff and so on. So I learned a lot by being involved with those sports myself. And, a little guy like me, 115 pounds playing football, when you wrestle, you're fighting somebody who's in your own weight class. So that didn't apply there. But when we were playing football, I'm weighing 105 pounds, 110 pounds. I'm playing against guys who are 240, 300 pounds. They could just pick me up by my waistband and, and throw me on the ground. Okay, it's one of those things. So I had to learn how to fend them off at the same time I'm doing the job I was given to do to help with
Right.
that touchdown.
That's right. Well, and as a little guy, Dr. Wallach, you have a little more agility than some of those bigger guys. So you might be able to just like worm your way through and take it on down.
Yep, that's what
But
I did. I wormed my way through. I didn't take them head on. They were too big for that.
no, I wouldn't want to take them on head on either. So Dr. Wallach, as I'm going through and I'm doing research, different organizations will throw up, okay, this vitamin or this vitamin are good for that. But through my research and working with you and realizing that one nutrient deficiency doesn't affect just one part of the body, it all the body. What would you recommend for somebody who has concerns about lung issues? Which, folks, if you've got lung issues, you probably have other issues. It's just the lungs are more on apparent to you and maybe something that's more a concern to you. And then once those lung issues start to die down, then those other things pop up. But folks, Dr. Wallach has put together a program that addresses the body as a whole. So rather than cherry picking, Dr. Wallach, you have come up with some formulas that synergistically work together. They include the 90 essential nutrients, plus what you consider special sauces that give extra nutrition for specific areas of the body. So if we have somebody that's looking at or dealing with lung issues, what would you recommend?
Okay, well, first thing is you got to get rid of the bad stuff to stop the ongoing injuries to the lungs and heart and livers and muscles and all that kind of stuff. So, no fried foods, no processed meats, no oils, no glutens, no wheat, butter, and oats, no buckwheat, no sugar, no carbonated drinks. Even the diet ones got to go. because the carbonation neutralizes stomach acid, so you cannot absorb nutrition or digest food. Okay. And then you need to have especially, even if you're sitting at a desk and not doing anything but using a pen, you still need all the 90 essential nutrients in optimal amounts, okay, to maintain function and repair and replacement of cells and tissues and organs and so forth, okay? And so that's something I learned at the autopsy table. The doctors were missing it badly. They were really missing it badly because they're treating one symptom, okay, instead of treating the whole body. So I learned if I'm going to get into this, I'm going to treat the whole body. And that has worked out very well, okay? And so I hear this all the time. In fact, today on one of my radio programs, I heard that the doctor had given somebody one nutrient. Are you taking either? Are you taking a multiple? Are you taking vitamins? No, I just eat well. Okay. Well, you're walking down a terrible, terrible, dangerous path there. Okay. Because you need to give your body everything it needs. Okay. Because you can't assume that you're going to get it from your food. For instance, up until 1882, we were getting our minerals from wood ashes and coal ashes, putting them in our food, putting them in our gardens, and we would get them that way. Okay, because we would burn the wood and burn the coal. And we get the wood ashes instead of throwing in the dumpster, we put them into our gardens as fertilizer. Okay, and the plants would suck up those minerals. But how many minerals did they have? 3, 25, or did they have all 60? Okay. And so then came in 1882 electricity, and everybody threw the wood and the coal away and went to electricity. Well, how many vitamins and minerals did people get from electricity? 0.
0.
So they threw their thousands of years of getting nutritional minerals from wood ashes and coal ashes. Over thousands of years, we got that. And then suddenly in 1882, we threw that all away. Within a couple of years' time, the whole world had shifted over to electricity. Okay, and they lost their traditional source of minerals. That is very scary when you think about it. And that's why you see all these diseases that they never saw before. They're not genetic, as you pointed out earlier. They're simple nutritional deficiencies. Okay. And so what I do is I say, okay, you need the one healthy brain and heart pack, which has 215 nutrients in it. I eat well. I don't care. You want 215 nutrients to guarantee you're going to get everything. Is your life not worth a couple of bucks a meal? So you take the one full dose of the healthy brain and heart pack at breakfast, one full dose of the healthy brain and heart pack at dinner time, and then you deal with the secret sauces. Okay. Then you want to add, let's say you have diabetes. Okay. Well, we have sweeties. Okay, which has the nutrients that are necessary for the pancreas to work properly and for your body to utilize sugar properly. But if you just take the sweeties only, guess what? It's not going to work very well for you. You might only get 10% of the value of it if you're not taking all the other nutrients.
So there's a couple of questions, Dr. Wallach. And when it comes to minerals, I know as I've been reading through your books and even other people's publications, that there can be over 600 different poor health conditions specifically relating to mineral deficiencies. And as you mentioned, and this is something that goes through my head all the time as I'm working with somebody and doing coaching. Oh, but I eat right. I'm like, okay, you eat right,
That's
but
good.
here
You're not
we're
eating bad
looking,
foods.
well, they're right, and what's on the bad foods list, there's a lot of overlap, Dr. Wallach.
Yep.
Okay. But they're dealing with all over body pain. They're dealing with joint issues. They're dealing with poor circulation. They're dealing with their hair falling out and mood swings
And lung issues.
and lung issues, but they're eating healthy. So that right there tells me if you're eating healthy, there's a lot of missing things in your diet. And even the NIH talks about malnutrition and taking oral nutritional supplements. I mean, this is the National Institute of Health, folks, that say that there are times, and it's like all the time, we need to intentionally be taking nutritional supplements because it's not in our food.
It's
And
correct.
when I and then as I'm working with somebody and they're resistant to taking nutrition because they eat right, yet they have all these different health conditions. You had mentioned that they use pharmaceuticals to treat a condition, but are they really treating the condition or are they masking symptoms is my question,
You're
Dr.
masking
Wallach.
symptoms because most of the time they're happy when the symptom goes away. And they praise their doctor because the symptom went away, and then a year later they die. Because most of the drugs that doctors write prescriptions for relieve symptoms only. They don't get to the basic root cause of the problem. And that's what I saw on the autopsy table. That was a big education for me. And even muscular dystrophy, worked with Jerry Lewis, Jerry's kids,
Hmm.
and found the cause, prevention, and cure of that. Because I had been working, as a veterinarian first. I was working with people. I was still working with people, but just on the side. But working with uh, Jerry Lewis and muscular dystrophy, I'm working with these calves that had what was called white muscle disease. White muscle disease in calves is muscular dystrophy in humans. So I took all the supplements we were giving calves for white muscle disease and started giving them to Jerry's kids. And guess what? In weeks, their muscular dystrophy went away. And that's how I discovered
Something's
the cause of muscular dystrophy because I just used the treatment for white muscle disease in calves.
and here they were doing a telethon that raised, is it millions or billions
Billions,
of
billion.
dollars
Jerry Lewis, over 46 years, raised raised $2.3 billion for them.
for a simple nutritional deficiency?
Yes.
Wow.
And to
Well,
see the thing that scared me was here's all these doctors and pharmacists and clinicians and nurses treating these kids for 46 years, and not one of them could figure out the bottom root cause was a simple nutritional deficiency in 46 years, even though they had all that money to look into the disease. Now that's what was
uh,
scary.
yeah, that is scary, Dr. Wallach, and that actually causes me hesitation whenever we have these big organizations wanting more and more money. And I've heard about your program. I've seen how it works within the bodies of other people and the reactions, responses, and them not having to deal with those things anymore. And I'm like, man, if people would just invest in themselves and make sure that they are getting a complete nutritional program, not relying on the food, but making sure that they're intentionally putting the nutrition into their body, we would be healthier as individuals, families, communities all around the world. We would be in a better shape.
Yeah, well, here's the equivalent to what is going on now. The equivalent of how people think they're getting a good deal when they're eating good. I'm eating good. What do I need to take vitamins for? Maybe the same thing as your car engine burns up because you're just putting dirt from Texas into your car instead of gasoline and oil. Well, I put dirt
Mhm.
from Texas in there. There's bound to be some oil and some gasoline in there. Now, most people are not stupid enough to make that try. But when people are saying I eat well, they're
Mhm.
putting their family, their kids, their spouse, their workmates or neighbors, um, again, their families in life and death situation. You got to give
But
you got to give everything. And so
especially,
if there's a little excess vitamin C, so what? It's a little excess calcium, so what? Okay. You've got to give it what the person needs for their body weight, plus the secret sauces for the disease they may have. You're getting a much better result than if you just say, well, I eat well. That's not good enough.
but not all supplements are created the same, Dr. Wallach.
Well,
Not
that's
all
true.
are sent from sources that the body can actually absorb and utilize. So I think
Taking,
that's
taking a
really
taking a
important.
vitamin, taking a vitamin mineral supplement that has 18 vitamins and minerals in there is not good enough.
Not enough.
You need 90.
Yes, 90 for life. That's right. Well, Dr. Wallach, we have some questions. And again, I want to remind everybody that if somebody's recommended you to this program, make sure that you get back with them. If there is no one to thank and you would like to speak with somebody about your concerns with health and get put on a program or get the recommendations of a program that Dr. Wallach would recommend, feel free to give our call team a call at 855-949-3377. This program is sponsored by dailywithdoc.com. You can also go to our website, see the replays of our programming, and get information about the products that Dr. Wallach is speaking of now. And you can also use that contact option and get connected with myself or one of our coaches to make sure that you're getting the nutrients that you need to address your concerns. Well, Dr. Wallach, I just want to thank all of our listeners, including those that are out there in Radioland on KOMY and KSCO. And we have the amazing Dave Michaels from KSCO with us. And a question wanting to know, Doc, does caffeine or coffee affect the absorption of minerals?
Okay. Well, caffeine um, actually causes urination. It's a stimulant to the kidneys, causes urination. So you may be absorbing everything, but you're peeing it out faster if you drink caffeine from tea or coffee. Okay, you get decaffeinated coffee, you get the taste of coffee. Okay, you're not going to get the energy hit because the caffeine will cause a little bit of energy. Okay, but if you drink 4 cups of regular black coffee a day, you are urinating out an enormous amount of nutrition.
So as you urinate and you're pushing through things through the body faster, that's reducing the opportunity for the minerals for absorption. Is that what I'm hearing?
That's what you're hearing. That's correct.
Okay, so then it can affect mineral absorption.
Oh, yeah.
All right. Well, Dr. Wallach, thank you for that. And let's go to the hand that is up. And the first hand that I see here is TC. TC, go ahead and unmute yourself. You're on live with Dr. Wallach.
Okay. You were just mentioning about coffee, but decaffeinated coffee is good for you, isn't it?
Well, it's okay. I drink decaffeinated coffee.
Okay. All right. Well, that's not the question I wanted to ask about, but I just brought that up because you were talking about coffee. When you said about tilting the bed up for my hernia with the 2x4, I did that. It made me nauseous. So I don't know if that's just like the first time doing that. I mean, it makes sense to do that to draw the pressure from the intestines, but against the chest cavity, the breathing's kind of shallow and the blood going to the head, it's kind of difficult to sleep. So I
Okay,
don't
well,
know.
see, stop there. Stop there.
Okay.
So you may have osteoporosis of the skull. If you have bone problems, you may have osteoporosis of the skull.
Okay.
And so it's putting more pressure on that 10th cranial nerve, the vagus nerve, okay, causing that symptom. Okay. So what I would do, instead of going up 4 or 5 or 6 inches to start with, I just go up 1 inch.
Okay.
Start at 1 inch, start low. Okay. And we have a cream that reduces inflammation, which will take a lot of the information away from the nerves if you have osteoporosis of the skull. And you can put the CM cream behind the ears, on your neck, the back of your neck, on the sides of your neck, and so forth. And it's one of those things where it's crazy what you see now. Just remember, we spend more money for healthcare than almost all the countries in the world combined.
Yeah.
Okay, and doctors are happy when they get symptom relief because patients are so happy they got symptom relief. Now I'm going to read to you. This is from the NIH. Okay, this is from um, NIH. They list, the top 100 countries by their age, okay, and their weight and all that kind of stuff. Number one, Hong Kong, they live to be 85.83. Number two, Macau, they live to be 85.51. Japan, they live to be, they're number three, they live to be 84.95. Switzerland, they live to be 84.38. Now, they're not an Asian, but they do come in at number four of all the 100 countries we're looking at. And because they live up in the mountains and the glaciers are grinding up the rocks, they're drinking that glacial milk. That's they're getting the minerals. It's very useful information. Okay, now I'm going to drop down to number 5 of Singapore. Let's see here, 84.28. Let's go down to South Korea, number 7, 84.14. Let's go down to
Okay, can I stop you for a moment though? I just wanted to know because I take melatonin, but I didn't know you mentioned about something for insomnia that longevity has. I know they have different sleep aids, and I was wondering if you could recommend one of those that might help me sleep.
Sleep gummies.
Yeah.
Which ones?
There's so sleep gummies
Sleep
are
gummy.
awesome.
Okay.
Yep.
Okay.
But we also have a sleep pack. So if you, and this is going to sound kind of funny, folks, but so that you can find it easy, if you go to the website sleepwithbecca.com, it's going to take you right to that pack. That is absolutely amazing as a secret sauce, as an add-on to the 90 that helps with sleep.
Okay. All right.
So again, that's sleepwithbecca.com, and you'll see the products that I used when I was having problems sleeping.
Okay. Also, what would I go to see the archives of these Zoomcasts?
So you can find the replays of our programming on our website, dailywithdoc.com. We also have them on our Rumble channel. So we encourage everybody to go over to Rumble because there's less censorship. And if you're part of our newsletter, you will see in your mailbox how we got a ding on YouTube because Dr. Wallach mentioned something about WHO, the World Health Organization.
Okay.
And you know, there's a lot of contradictory information as far as what is being taught by pharmaceuticals and what was actually used within creation to create this bodies that we have that are not pharmaceutical deficient. So we got a ding on that. So we encourage everybody to go over to Rumble and make sure that you're following us on Rumble. That is Critical Health News. You can find us there. Also look for our Daily with Doc channel.
What I do when I find specific shows? I mean, like
if you go to our channel, you can do a search and search for like a symptom or a part of the body, and it'll bring up those programs that talk about that.
Okay, I'm going to interrupt here because I want to help this guy out. Okay, I want to talk about just briefly, 2 countries left out of the 100. So we're only talking about 6 countries here. We've talked about 4 or 5, whatever it is. Let's talk about the last 2 that I want to talk about. Number 10 is Australia. They come in, their average age is 83.75. Okay, let's go to, let's see here, number what? Okay, let's go to number 47. Let's go all the way to number 47, okay, from number 10. The average life expectancy of the country that comes in 47 out of the top 100, according to the United Nations, 79.74. That's their lifespan, 79.74. You know what country that is? America.
America.
Guess it's going to be America.
We come in 47th. We come in 47th out of the top 100.
Oh, yeah. Okay.
So that's because doctors are treating symptoms. They're not getting down to the basic root cause. So if you have pain in your back, they give you some cortisone, and in 3 days, the inflammation goes away. While your bone is still crumbling, the inflammation goes away, and you're very, very happy about that. And 2 years' time, you die. But you were happy for those 2 years because you didn't have the pain.
Right. The cause is still there.
The cause was still there.
Okay.
So that's why we're different. Okay. And so when we're talking about lungs and all the various peripheral things that afflict the lungs, that's very scary when you think about it. How many things have a negative impact on the lungs?
A lot.
Yeah. Okay. Well, that's all I needed. So,
Okay. Thank
okay.
you.
Okay. Thank you. Bye.
All right. Thank you, TC. And Dr. Wallach, let's go to the next hand that we have. And Gary, go ahead and unmute yourself.
Hey Doc, it's good to see you again. I heard you on with George Norrie about what happened in Canada, but I'm glad you're back, man.
Yeah.
I'm glad to see you.
George is one of the greatest.
Yeah, yeah. Now I have a testimonial again. I have a photo of me, I told you, right here with gray hair. Do you see that?
Mm-hmm.
And look at me now, right there.
Wow.
I don't know if you could tell the difference.
Oh yeah.
There's a difference.
There is a difference. Do you see a difference? Well, oh, I just blacked.
I,
Oh, wait. So anyway, I'm on your Healthy Brain and Heart Pack, 2.5 years, Ultimate Daily Classics, the MSM, the vitamin D, the vitamins, the omega-3s, and I haven't felt better. Oh, I had a blood clot before because when I talked to you 2.5 years ago and you told me if you follow me and you follow exactly what I'm doing with the diet again with the nutrition, you will start to get black hair again. And I started laughing in your face, and you said to me, "You're laughing at me." And I said, "Oh, come on, Doc. Like, like really?" And it's look. I mean, right there, there's a black spot. Do you see it?
Yes.
yeah, it's dark on top, and I also see that your mustache is darker as well.
Yeah, a little bit. Now,
Yeah.
I
Wait
have
a minute. So before we move on, I want to add one more thing here. Okay. We have a product called Hair, Skin, and Nails. And if you
I'm
want
taking
that,
it.
okay, good. Double up on that one.
Okay, now this is what I wanted to ask you about. Everything is fine, but what happens? I had the blood pressure controlled and down, and it's not controlled anymore. It's too high. Am I missing? Do I need to double up on the Ultimate Daily Classics? I'm only taking one bottle a month,
Okay, how much do you weigh?
180.
Yeah, you need to be taking 3 twice a day. I only weigh 140 and I take 3 twice a day.
So do you think that's my problem? I'm worried about my blood pressure.
Yes. Yeah, take 3 twice a day. Move it up.
Move it up. And that should, I mean, is there a reason? Well, I am a little high strung.
Well, we're talking about absorption, dosage, and so forth. And do you live in a household where people are eating gluten?
No,
Okay, good. All right.
no gluten. I'm off of gluten. Okay, well, so do you think maybe because of the low dosage of the Ultimate uh Daily Classics, you think I need to, you said triple up, you said. Didn't you say three? What did you say?
Yeah, 3 doses a day.
So that'd be 3 twice a day, or 3 times a day.
Oh, two,
Sorry.
3 times a day. Yeah, I was taking one 3 times a day.
And see, you got benefit from that 3 times a day, so just double it up.
Okay, now one other comment about the hernia, because TJ had a hernia and you said, and I had an inguinal hernia too. I propped up my bed. I'm doing it for about 1 year and 3 months now. And I'm doing yoga exercises for the abdominis transverse muscles to make them strong. And I may be reducing it's slow. It's a very slow process, but I'm taking your advice and I'm following what you told me along with some yoga exercises for the hernia, and I think it's working, but it's slow.
Okay, now, during the day, do you wear a belt, a hernia belt?
Yes,
Okay,
I have it
okay,
on.
good.
I have it on right now. Yeah.
Okay, good. Okay,
Yep.
so it's better that you're slowly moving forward than rapidly moving backwards.
Yeah, but my blood pressure is pretty high, so I'm
Move up
worried.
on the Ultimate Daily Classics.
Okay, all right. Thank you.
You bet. Keep in
All
touch.
right. Thank you, Gary. So, Dr. Wallach, we are at the end of the program. As I'm going through the comments, though, we have somebody that is recommending Dr. Wallach for U.S. Surgeon General.
Oh, wow.
So, hey, we could get Jonathan Emord there in the presidency eventually, and you as U.S. Surgeon General. We'd be a really happy, healthy place.
We want to make America a healthier place. And it just shocked me when I looked at the World Health Organization numbers that we came in 47th when it came into longevity. We came in 47th.
That's a little low on the totem pole of health.
Well, basically, here's an organization that has nothing to do with our program we're working on. They're just collecting ages from people, and it shows very clearly. These Hong Kong, 85.83, okay, and then you're talking about the United States, America, 79.74. We came in 47th. That is scary. We came in 47th. We're spending more money for healthcare than probably all the other nations, first world nations in the world. Okay, and so that's very scary that we're not getting the dollar's worth. You would not be satisfied if you're getting the same equivalent results for your car, maintenance.
Right. Wow. Well, Dr. Wallach, we definitely need to make sure that this information gets spread throughout the world, because it's not just the US that has issues with poor health concerns. As you've mentioned in the Bible, it says our man's years should be 120. And all of the numbers that you read off are lower than 120.
Yep.
So there's room for improvement, right?
A lot of room for improvement.
And that starts with knowledge, giving your body a different set of requirements as far as what we put in the bodies, rather than relying on a
Becca,
food pyramid that has
Becca,
changed
I
too many
want to insert
times.
something here. Becca, I want to insert something here. I know we only have a minute or so.
Yep, go for it.
When you look at the Hunzas, their life expectancy is 120. Okay, they don't have any medical doctors. And then when you look at in France, Jean Calment in 1994, I believe it was 1994, she died at 122 years and 164 days. And they sent all kinds of people from all the states and different countries. And they checked all the records and everything, and that was correct. So why did she live to be 122 years and 164 days, and her medical doctors are dying at 58 in the emergency room?
Well, she did something a little different than they did, and the press might have had something to do with it too. Well, folks, thank you so much, Dr. Wallach, for spending time with us today. And we appreciate the knowledge that you provide, and just being the leader in giving empowerment as individuals in what we can do to help ourselves, Dr. Wallach.
Well, thank you so much for the kind words, Becca. And of course, you got to throw you in there too, because you're in up to your armpits in this, making sure everything goes the right direction. Thank you enough.
Well, it's definitely part of my mission, because I have been helped so much by the program that Dr. Wallach has put together. Not only just the program for the nutrition, but also eating and what we put in our mouths, that is developed by an industry of fast, quick, over-processed, and under-nutrified. So folks, we really need to take a look at what is most important when we want to enjoy getting older and not be dependent on something to ease the pain or mask the symptoms. Because if you're having to mask symptoms, there's usually a better way to not have to mask the symptoms. I have to be careful, doc, because I don't want to get another ding. But, you know, how do you mask the truth, folks? We shouldn't have to. So we encourage you to share this program with others. Share Dr. Wallach's publications that, again, you can find at drjwallach.com, and start implementing them into your life, the lives of your families, and as your communities see the difference, share with them as well. So together, as we all are sharing, we'll have a healthier world. If I can get my co-hosts up with me, I just want to do a special thanks to them as well. We would not be able to do this without them in this program. We have Marilyn, who is doing a great job as she's doing transcription of what is being said into the chat, which is a benefit of being here live with us, folks. We are working on getting 4 to 5 days of the week again with Dr. Wallach, with Pharmacist Ben, and other experts within the community who share in the belief, not just because they heard it, because they're feeling it too, and what Dr. Wallach has been teaching and part of his 90 for Life crusade to save humanity and the world. We have Albert way down in South Africa who is here with us. It's 10 hours ahead of time for where we're at, so it's coming, pushing close on midnight. So thank you, Albert, as he believes in the message as well and wants to continue to spread the message in his part of the world. We have Sherry, who is helping us with the broadcast and making sure that it's getting out. Also, we have AJ, who is helping get out on the platforms and working on our newsletter, which Marilyn has contributed greatly to, and getting us on all the different platforms that people are at. So we want to know where you're at. Again, leave us a comment, give us some likes, share some love, and subscribe to our channels and share. Folks, my name is Becca Dukes, and it is my honor and privilege as not only the hostess of this program, but also the Director of Student Services for the Institute of Holistic Health, that has taken Dr. Wallach's message. We've put it into a course format so that people can reach it no matter where they're at, to become a certified holistic health coach and help. If it's not just for themselves, their families, their communities, it's affordable. So even if it is just for our family, it's much worth the cost. And Sherry, who has multiple certifications with health coaching, has found that the Certified Holistic Health Coach course through the Institute of Holistic Health has been very instrumental in helping her coach her clients so that they're getting better results. You can too. Reach back to the person that shared this program with you. If there's no one to thank, give our call team a call at 855-949-3377. Until next time, bye for now.